wonder why some people see the world in a completely different way? Today, we are talking about autism, not as a disease, but as a different way of thinking, feeling, and experiencing life. Autism or autism spectrum disorder is a neurodevelopmental condition that affects how people communicate, interact, and process information. But here is an interesting part. Autism isn't the same for everyone. It's different for different people. It's called a spectrum because it shows up differently in every person. Some may have challenges with social skills, while others may have incredible focus on unique talent. So, in this video, we are exploring what autism really is. Let's begin and learn in detail. Introduction. Imagine being in a room full of people, right? Imagine that you are in a room and there are a lot of people, but feeling completely disconnected from them. You feel you're not one of them, right? You feel yourself in isolation. So you are there physically, but emotionally and socially, you feel miles away. So this is okay. What previously I talked about social skills. You are facing challenges with some social skills. This is reality for many children with autism spectrum disorder or ASD. So these letters stand for autism spectrum disorder. Autism. Today, we are going to explore the world of autism, a condition that affects millions of people worldwide, shaping how they perceive and interact with the world. So, this is a very common phenomenon these days. And many parents complain about their children that what happened to them, why they behave in such a way, why they talk in such a way, right? And like why they lack some talents. So this is a challenge. So by the end of this lecture, you will gain a deeper understanding of what autism is, its signs and symptoms, and how we can support those living with this autism. So let me check. Recording is going on. Yes. So, first we define that what is autism. Autism spectrum disorder or ASD is a developmental disorder that impacts how a person thinks, behaves and interacts with others. Right? So this is that how a child or how a person behaves and interacts even with their parents and with others. So it's called a spectrum because it can affect people in many different ways. As the beginning I talked about, some may have mild symptoms while others may have severe challenges and that will affect their life. Autism affects about 1 in every 54 children worldwide. It's a huge concern, a big concern that uh, 54, out of every 54 people, one of them is affected by autism. And it is diagnosed more than in boys than in girls. And this autism can be identified and can be seen in more in boys rather than girls. So, core characteristic of autism. While each person with autism is unique, as in the beginning I told, so there are some common characteristics that help us understand the disorder. It's not a disease, it's a disorder, right? Neurodevelopmental disorder. So let's break them down into three main areas. First, social communication challenges. Some people or some those who are affected by autism may face social communication challenges. The first one. So you can see that children with autism often find it difficult to understand and engage in social interactions. As I told in the beginning that you are in a room full of people, but you feel yourself in isolation, or emotionally you distract yourself from them. So you see that children with autism often it's find difficult to understand and engage in social interaction. It's one way of looking at autism. So they might avoid eye contact, struggle with making friends, or not understand the concept of personal space. Now you think, okay, that how many of you watching this video lecture, you can understand yourself. Whether you're lacking in this social communication, it's difficult for you, right? To understand the concept of personal space, to have eye contact with people, and find it difficult to make friendship with other. If you have this, so you are suffering from autism. Second, that one is repetitive behaviors and interest. What is this? Some children may engage in repetitive body movement like rocking or flapping their heads. Sorry, their hands. Other may fixate on a specific object or interest, sometimes for hours at a time. So you can see this child is having some objects in hands and focusing on it. So some children may engage in repetitive body movement repeatedly, right? Over and over. They will be engaged in rocking or flapping their hands. Rocking or flapping their hands, right? Other may fixate on a specific object or interest. You are interested something, you have an object in your hands, and sometimes for hours at a time. So this is a second way of looking at autism. The third one is sensory sensitivities. Children with autism often experience sensory sensitivity, sound, textures, lights, and smell, and others may barely notice can overwhelm them. So you see that in your surrounding, uh, you often experience sensory sensitivity like sound, texture, lights, and smellers that others might barely notice can overwhelm with them, but you can't. So this may happen with you. Now, facts about autism. Autism isn't caused by bad parenting or any specific trauma. It's not because of bad parenting. Children's they are not treating, they are not parenting, they are not, taking care of their children, or a specific trauma. Early diagnosis and interventions can make a huge difference in child's development. Okay, there's early interventions. Children with autism may have intellectual disability, so they will not be intellectually fit, but many have average or above average intelligence. They will not be intelligent like other. Autism is a lifelong condition, but many individuals can lead independent, fulfilling lives with the right support. They need support. You can support people who are suffering from autism. Sign and symptom of autism. Recognizing the signs of autism early can help parents and caregivers get the support to child needs. Here are some common signs and symptoms of autism that if we know a child is suffering from autism, and how can you support them. Limited or absent speech development. So if your child has limited or absent speech development by the age of 4 and 5, you should understand your child is suffering from autism. Difficulty with eye contact or facial expression. Look at the facial expression of your child and look at the eye contact. If your child cannot make eye contact with you or with others, or look at facial expression. So you should understand your child is suffering from autism. And limited interest or difficulty making friends. This is also one of the symptoms. And engaging in repetitive movements like rocking or hand flapping. This is also one of the signs. And extreme sensitivity to sensory stimuli like light, sounds, and texture. So if this issue is with them, extreme sensitivity to such things, sounds, light, and texture, you should understand your child is suffering from autism. Now, causes of autism. Autism is a complex condition and reaches and researchers are still working to fully understand what causes it. What are the causes of autism? Before this, we talked about symptoms. However, we do know that autism is influenced by a combination of genetic and environmental factors. So, two things are there. One is genetical, it comes from your parents, right? And second, that is environmental factors, in which environment you're living in. So, these two are the core causes of autism. Some factors, there are more factors, some factors may contribute to autisms include like genetic factors, as we mentioned, from your parents, great parents, genes. Studies suggest that certain genes may play a role in developmental of autisms. Environmental factors, certainly environmental influence during pregnancy, and it is now observed that sometimes you have some vaccinations, and those vaccinations during pregnancy can also affect your children, and they may have autism also, like advanced parental age or complication during pregnancy. Sometimes there'll be some complication during pregnancy. It may also, or new research say that it might be because of vaccinations. So you see that the research is going on. May slightly increase the risk of autism. And brain development research shows that some areas of the brain develop differently in children with autism. So if your child is suffering from autism, so one of or some of the brain of the part of the child may develop differently. That's why that your child behaves differently. Diagnosis and treatment of autism. Diagnosis autism typically involve a team of doctors, right? Doctors may help you, support you, including uh, where we are. Diagnosis autism. Okay, diagnosis autism typically involve a team of doctors, including pediatricians, psychiatrists, and speech language uh, pathologist. Now, the diagnosis is based on a combination of developmental, history, behavior, observations, and standardized test. So this is okay. That how can we diagnose? Doctors are there, right? And psychiatrists are there. Language pathologists are there, right? They can help you. Now, while there is no cure for autism, early interventions can greatly improve outcomes. A variety of therapies can help children with autism develop essential skills such as speech therapy. If you help them in early childhood, so you can improve their speech therapy. To help improve communication skills, what doctors suggest, there is a characters on YouTube. Um, you see that my child is also watching, and I'm forgetting her name, Rachel, Miss Rachel. So you can let them to watch it. So behavior therapy can be also a treatment to encourage positive behaviors and reduce challenging one. And occupational therapy to help children cope with sensory sensitivity and develop daily living skill. Support and resources for families. Supporting a child with autism requires patience, understanding, and the right resources. There are many organizations, support groups, and therapists available to help families navigate and challenge of autism. Connecting with others who are going through similar experiences can be empowering and provide invaluable support. Who went through the similar process, so you can take help from them. Doctors are there, organizations are there, they're helping in this regard. So programs like early intervention service and specialized schools and support networks can help children with autism thrives in both educational and social environment. So this okay support and resources for families. Real life success stories. Despite the challenges, many individuals with autism lead happy, fulfilling lives. Let's take a look at a few inspiring stories. Now, Temple's Grindon's, a renowned professor and animal behavior expert, is one of the most famous individual with autism. Now, Sochi Tajri, the creators of Pokemons franchise, has spoken openly about his experiences with autism. These are success stories. And these stories remind us that while autism presents unique challenges, individuals with autism can achieve great things. If you're suffering from autism, so we know from these people that how they were and where they got. So, conclusion, we can conclude autism is a complex and diverse condition, but with early diagnosis, appropriate interventions, and a strong support system, individual with autism can live meaningful and successful lives. Understanding autism not only help us support those affected, but also break down microconceptions and promotes uh, acceptance in our communities. So, thank you for joining me in today's lectures on autism spectrum disorder. If you focus this video informative, please like, subscribe, and share with and spread awareness about autism. Let's continue to learn, grow, support, and one another. Thank you so much. It was all about autism. Please, I need your support. Uh, to grow this channel further, and please provide your valuable comment in comment section about today's lecture. What is autism? Core characteristics. We talk about social communication. Some may face this issue, right, suffering from this. Some may suffering from repetitive behaviors and interests, and some may suffer from extreme sensory sensitivity. They have problems with sounds, problem with light, okay, or problem with some textures objects. So this was all about autism. Thank you so much.